Good morning, you're tuned into Daily Coronavirus Updates. Today is the 18th of May and you're watching The Wire. India's total caseload as of now has surpassed China's official tally on the number of cases. According to official figures, India has the maximum number of cases in Asia as of now. The total number of infections in India is nearing 1 lakh and more than 34,000 people have recovered. More than 30,000 people have been infected in Maharashtra alone and over 1,000 have died in the state. The total death toll of India is nearing 3,000. In Delhi, an assistant commissioner of police posted at Rashtrapati Bhavan tested positive for infection yesterday. The officer has been shifted to a hospital and his office and nearby areas are being sanitized. An administrator at the Ahmedabad Collectorate office died of coronavirus yesterday after he tested positive for the virus last week. Over a dozen employees at the Collectorate office have now also tested positive. Last evening, the Ministry of Home Affairs extended the nationwide lockdown till the 31st of May. Lockdown 4.0, as it is being called, will allow movement of interstate vehicles, buses and passenger vehicles, but only with mutual consent of states and union territories involved. The delineation of red, green and orange zones for this phase of the lockdown shall also be decided by the state government and union territories. Movement of individuals except for essential services will remain prohibited between 7 p.m. to 7 a.m. In a separate order, the centre has also asked officials from 30 municipal areas which contribute to around 79% of India's coronavirus cases to maintain high vigil and closely monitor areas of old cities, slums, migrant labourer camps and other high-density pockets. These areas should have maximum restrictions under Home Ministry's Lockdown 4.0 rules. Given the scale and the size of the pandemic in one of the highly populated countries in the world, a public health expert and epidemiologist Giridhar R. Babu has highlighted that COVID-19 would peak at different times in different states and there is not going to be a uniformity across the country. He said that the infection is escalating in states like West Bengal, Madhya Pradesh, Maharashtra and Gujarat, and in these areas things will have to be completely different in terms of containment. Earlier this month, AIIMS Director Randeep Guleria said that India is likely to reach its peak in the months of June and July. On Friday, the Bombay High Court directed BMC to file an affidavit with the list of clinics and maternity homes offering services to expecting women across the city, and also provide an account of the number of deliveries conducted by medical institutions during the lockdown period. The move came after a pregnant lady from Nagpada on the 27th of April tried to get admitted at JJ Hospital in Mumbai, but was allegedly refused admission since she was unable to produce a COVID-19 negative report. After this, the woman had to approach 3 other hospitals to get admitted. After being turned down by the 4th hospital, she was forced to give birth at home with the help of a midwife who was present outside one of the hospitals. The petitioner urged the court to direct authorities to adopt appropriate measures to avoid such situations. An investigation by IndiaSpend of Bihar administration's door-to-door screening of COVID-19 has revealed that 4 districts in the state are skipping entire households and conducting incomplete interviews for the survey. According to the report, on 15th of April, Bihar government started the door-to-door screening in 4 cities. By the 2nd of May, the state claimed to have completed screening in 6 of the state's 38 districts. Of these 6 districts, IndiaSpend spoke to people from 4 districts. A farmer from Siwan district told the media website that out of 100 households in his village, not a single one has been screened, including his own house. Another resident said that the team asked her only for the names of the family members and nothing about their symptoms or anything else. But officials told IndiaSpend that not a single household was left out of the screening. To learn more about the story, you can read it on IndiaSpend.com. After news reports poured in that public and private hospitals in Mumbai are running out of beds and patients are being put on wait lists, the BMC yesterday announced that they will increase the bed capacity for COVID-19 treatment at its various facilities to 1 lakh. 15 inmates at the Rohini jail in Delhi have tested positive for the infection. This came after a 28-year-old inmate tested positive and these 15 others shared the barrack with him. The Delhi Prison Department has so far tested 19 inmates from the barrack and all have tested positive. All inmates and the staffers are asymptomatic so far. The head warden, along with several other staff members, have been sent to home quarantine. The WHO warned countries on Saturday that spraying disinfectants on street does not eliminate the new coronavirus, rather poses a health risk. The WHO said that streets and pavements are not considered as reservoirs of infection, adding that spraying disinfectants even outside can be dangerous for human health. The document published by WHO also stresses that spraying individuals with disinfectants is not recommended under any circumstances. Over the weekend, Brazil's confirmed cases of novel coronavirus rose past that of Spain and Italy, which were once the epicenter of the pandemic. Brazil's outbreak is now the fourth largest in the world. According to media reports, this global distinction may put pressure on President Bolsonaro after two health ministers in Brazil quit within a month. The health minister who recently joined Bolsonaro did not give any official explanation before resigning. Bolsonaro has also called for global criticism by dismissing the virus as a little flu. According to Russia's official figures, around 2,305 people have died from coronavirus so far, and the confirmed cases in the country are over 252,000. Earlier this week, Russia's total cases overtook those of Spain, which has reported close to 27,000 deaths. The WHO has said that it's in talk with Russia about the country's statistics for coronavirus deaths, which at 0.9% is far below the global average and the lowest among nations with highest number of infections. Moscow's health department, however, has said that more than 60% of fatalities of people suspected of having contracted COVID-19 are not classified as coronavirus deaths because they occurred from other causes. Health Ministry of the country has also said that it follows international statistical rules in classifying the deaths of people. A senior professor in virology at the University of Kent in the United Kingdom has said that Russia's dramatically low numbers on the world stage seems to imply that the risk of death from COVID-19 is lower than it in fact is. He added that being open in terms of reporting is really important to understand the range of fatalities occurring. To read more coronavirus updates along with other news and analysis, keep reading and watching The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.